Hello, everyone. I'm Dr. Carmen Puliafito, and today I have Dr. Stephen Yeh, who is the Truhlsen professor at the Truhlsen Eye Institute at the University of Nebraska Medical Center in Omaha. Stephen, welcome back to Retina
Thanks,
Sensitive.
thanks, Carmen. It's great to be here.
So, Stephen is an expert on uveitis and new therapies for retinal disease. And today we're going to talk about IL-6 inhibitors. IL-6 has been identified as an important mediator of ocular disorders such as macular edema. Can you tell us about IL-6?
Yeah, absolutely, Carmen. And I'll just take a step back and very broadly as we think about the conversation around uveitis. As we know, it's a very vision threat. It can be a vision threatening condition. It can be chronic and affects individuals in the United States and around the world to the extent that some people report that over 10% of individuals may be blind. Blindness is actually caused by uveitis. And the therapies that we have for uveitis are imperfect. We have systemic therapies which can be effective, but things like medications like corticosteroid can lead to elevated blood pressure, mood swings, weight gain. Immunosuppression also has its own set of side effects, and local injection therapy can be effective, mostly come in the form of corticosteroids, which can have side effects of elevated intraocular pressure leading to glaucoma and cataract. And that really brings us into why we're thinking about more targeted therapies like interleukin 6. And IL-6, as its function and is important for in the eye for as an immune defense system, but it also can lead to severe inflammation. It can lead to retinal swelling as well as changes in retinal vascular permeability, and also can lead to chronic inflammation. And so, as we think about interleukin 6 inhibition with the medication vamikibart, which was studied in two large phase 3 studies, MEERKAT and SANDCAT, these studies actually looked at vamikibart for the treatment of macular edema due to non-infectious uveitis. And in these two trials, it showed that visual acuity was improved in a meaningful way by anywhere between 2 to 3 lines of visual acuity for patients with macular edema due to non-infectious uveitis. And this was also reflected in anatomic outcomes by OCT measures, which showed about a 200 micron reduction in central subfield thickness, again, across these two studies. These data were reported by Dr. Rahul Khurana and Dr. Eric Suler back in the latter part of 2025, and really has generated a lot of excitement about the impact of biologic intravitreal therapy for macular edema due to non-infectious uveitis. And I think this is something that we want to have on our radar, given its potential for the treatment of patients with uveitis in the future. It's an exciting time.
So, how does this fit in compared to the use of corticosteroids?
Well, that's a great question. I think that we're still learning about this therapy with regards to the therapies in terms of how it was used, how it will eventually be used. At least in the clinical trial, patients were administered 4 injections given on an every 4 week basis. And after week 16, which is the primary endpoint, patients have now been enrolled on a PRN basis, and those data remain to be seen. We're looking forward to what we're seeing in the future. So I think the concept is that patients with macular edema due to non-infectious uveitis, whether it be anterior, intermediate, posterior, or panuveitis, have the potential to benefit from this therapy in the future. So I think this is going to be a useful alternative. Again, it's very targeted. So the question is whether there are certain disease subtypes that will respond better than others, or whether this is very broadly acting. And these are areas that we're still going to continue to learn about, whether there are specific disease states that will be impacted by anti-IL-6 therapy, or whether this could be used broadly, but particularly for patients who have a history of steroid response, patients who are at risk for cataract, younger patients. I can see a number of case uses where we would consider this therapy as we look forward to further data and regulatory considerations as well.
You've been an expert on suprachoroidal delivery of steroids. We had you on the show talking about that. How do you think that fits into the picture?
Yeah, well, I think that when we think about suprachoroidal corticosteroids, again, this is targeted, but in a different way. This is suprachoroidal corticosteroid is targeted more from an anatomic perspective, leading to high levels of corticosteroid within the posterior segment tissues and high distribution within the retina and choroid compared to lower levels within the anterior segment. We know that the suprachoroidal corticosteroid also has led to significant gains in best corrected visual acuity. At least when we look across the population, about 40% of individuals had 3 lines or greater of best corrected, actually about 40 to 50% of patients had 3 lines or greater of best corrected visual acuity improvement with the suprachoroidal. So again, this is very broadly acting, at least when from a design perspective, corticosteroids tend to last longer, at least 3 months. Up to 6 or even 9 months in some individuals. The way that vamikibart dosed, it was dosed again on an every 4 week basis. I think it'll be interesting to find what the durability signals look like with vamikibart as we see the next data cut as the study is carried out to a longer time point.
What about diabetic macular edema?
Yeah, so fascinating topic. Again, this is the subject of a lot of interest, and as we're all familiar with, diabetes involves not only changes in vascular permeability and issues surrounding ischemia, but also the role of inflammation. And then we know that interleukin-6 is certainly a player within diabetic macular edema as well. I think that when we look at how IL-6 and inhibition may play into treatment of diabetic macular edema, I think it certainly is a promising area as well, and an area that's being studied and should be studied more closely. But ultimately, when I think about diabetic macular edema, we also think about other factors, VEGF being one of them, and thinking about the potential for bispecifics. I think there's also another consideration, but whether interleukin-6 could potentially have a role, I think there's a lot of excitement around it. It really remains to be seen as we take this out to other clinical trials.
Kodiak has an IL-6 inhibitor that they're studying. What can you tell us about that study?
Yeah, so I'm not as familiar with the Kodiak study, but at the same time, when I think about what a lot of what Kodiak has done, they've also introduced the concept of durability because of the vehicle that the medications are instilled in. So I'd be interested in not only in the benefit, but also whether we see increased durability. But I think this is something that I'd love to see another episode on retina synthesis about the Kodiak study as well.
Well, Kodiak is pretty early. I guess they're in phase 2 right now.
Okay,
Uh, uh, iPoint says vorolanib has IL-6 inhibitory activity as well. Could
right.
so they say it's a bispecific TKI inhibitor. What do you think?
Well, I'm excited about any. I mean, when we think about just TKIs and the role of like multiple targets, I think there's a lot of promise with that as well. And what we've also learned from the largely from the uveitis world, at least in our understanding of, is that IL-6 is a pleiotropic cytokine, meaning that it can be broadly acting, but at the same time, there are other factors that also act on IL-6. And so if you see reduction in IL-6, there may be other downstream benefits as well. One of the aspects as we think about IL-6 and what it does, it also leads to an activation of IL-17 and also which IL-17, which is a key player in development of disease chronicity. And so whether one could potentially limit IL-6 and thereby limit other elements of disease chronicity is also important as we think about all of these conditions that end up needing chronic treatment and again chronic targeting of treatment as well.
Hmm. When do you think the Genentech drug might be in the marketplace?
Well, I think it's a very interesting time. I think it's hard for me to know in terms of what timeline looks. What I will say is that the data thus far in the 2 phase 3 trials was very encouraging. I think it'll be really fascinating to see what we learn in the next 6 months related to other data cuts. The other aspect that I think is also very important as we think about new drug therapies are the low rates of adverse events, which I think also speaks well as we think about considerations related to regulatory bodies. And so I think this balance of promising efficacy with strong safety signals will both play in the role of hopefully soon. This is something that I think that patients need. And with the therapies that we have, well, there's a lot of excitement about a number of therapies that are already on the market. It'll be exciting to see a targeted biologic therapy that's intravitreally delivered that was, again, developed for uveitis and potentially could open other doors for biologic therapies that are also targeting inflammation that can be used for other diseases downstream as well.
Are there any other targets that are out there in
Yeah,
this domain?
right. Well, I think that when we think about just the field and treatment of inflammation, again, we still think about systemic therapies as well. And so I think that we also want to keep anti-TNF alpha therapy involved in the conversation. We know that adalimumab has a strong track record of treatment for inflammation associated with uveitis as well. In addition, now we're seeing the advent of increasing biosimilars that we're seeing in the rheumatology domain as well. And I think that it's important for us to really understand and ensure that these biosimilars also work for the treatment of non-infectious uveitis. I think beyond that, there's other medications, the JAK inhibitors, again, given systemically, also can dampen inflammation. And so there's brepocitinib, which is also being evaluated. And again, these medications are more in the domain of systemically administered medications used as a steroid sparing effect as well. But on the local side, I think that vamikibart, again, it's a unique medication, unique mechanism of action. And so down the road, it'll be interesting to see how this plays out and potentially future targets as well. I think our interest in biologic therapies, I think, was perhaps slowed when the local anti-TNFs delivered intravitreally led to a series of intraocular inflammatory events. And so I think that having an IL-6 inhibitor that's studied with a robust study design and a strong safety signal, I think is very encouraging.
Well, this is an exciting new chapter in retinal therapeutics. And thank you for sharing this with us this day.
Yeah, thanks so much, Carmen. It's great to be with you in Retina Synthesis.